name's Mark Sexton. I'm with NVMedTech, an information security and compliance firm in Reno, Nevada. We assist healthcare providers in compliance and information security issues that they confront. Today I wanted to talk about safe harbor provisions under HIPAA and also the safe harbor provisions for those that are in Nevada Revised Statute 603A. First off, we should talk about what is safe harbor, what does that mean? And in essence, safe harbor is you're indemnified from breach reporting if you follow certain procedures and implement certain technologies. And what does that really mean? It means that if you encrypt your data, both in motion and in transit, you have particular policies in place and procedures in place for your workforce to follow, that in the event of a data breach, as long as the data is fully encrypted and you can document that, it becomes a non-reportable event. The same is true under NRS 603A for those in Nevada. Now what does that mean? It means you don't have to notify the people who suffered the breach, because as far as the Centers for Medicare and Medicaid are concerned, encrypted data that is lost is not viable, it's not usable, and not readily obtainable, therefore it does not constitute a breach. I'll go with that. So, what does it take to obtain safe harbor? I mentioned, encryption. There's a little more to it than that. But let me define some terms for you. I said encrypt data at rest. And what does that mean? That means that data that is residing on any server, tablet, phone, any type of electronic device is encrypted at all times. Most of your practice management and EMR systems handle that transparently. The information on the system is encrypted. It's not a big concern. If you have data sitting on a file server, for example, forms, notes, other types of information, that's a potential area that you want to examine. By encrypting that data, you satisfy the data at rest requirement. And for file servers and non-clinical systems, an easy way to fulfill that requirement is to use whole disk encryption or whole drive encryption. It's supported both in Windows and on the Mac OS. It's transparent to the users. And what that really means is if someone were to actually physically steal that system, the entire hard drive is encrypted, and without the appropriate password or decryption keys, the drive is basically useless. They could reformat it, use it for something else, but they won't be able to extract the data from it. Now, I talked about data in motion. That's the tricky part. Whether your data is going over a wireless connection or a wired connection, it needs to be encrypted. Now, EMRs point to point from, say, your tablet to your EMR, that data will be encrypted. Data you send to any third-party providers will be encrypted, such as billing information. So the idea there is no matter where the data is, it's always encrypted in all forms. Okay? That makes sense, but you'd be surprised. Now, there is really no additional cost or overhead to encrypting data like this. The wired and wireless stuff is handled fairly well by applications themselves and by the systems themselves. Whole disk encryption, I think, is a solution. If your system were stolen, say you had a burglary and they stole your practice management system, if, for example, the data were not encrypted in the practice management system and or the hard drive was not encrypted, you've got a reportable breach and you're going to be notifying people. And if the number exceeds 500, you're going to be notifying the local media as well. And we all know trust is everything in healthcare. People need to trust you to take care of them, and now they need to trust you to take care of their digital information as well. I mentioned a little bit about NRS 603A. Nevada has its own data encryption standard. In that standard, they talk about personally identifiable information as opposed to PHI. Personally identifiable information is really geared towards financial information. If you're handling transactions, processing credit card payments, or things like that, and you're maintaining customer information, NRS 603A applies to you. The standards for Safe Harbor in 603A are the same as HIPAA. Encryption of data at rest, encryption of data in transport, documentation that is in fact happening, and training and policies and procedures that support that within your organization. Part of what we do at NVMedTech is help you get to that safe harbor place where a breach is not a breach. That is the goal. That's all I have today for you. This is the first in a series of talks, Safe Harbor being the first one. I look forward to talking to you some more about some of the issues that confront healthcare. Thanks a lot. Have a good day.